It's been more than 2 decades that you have been doing this. You started our training.
In today's world, the normal lifestyle and all that, right?
This is to, of course, make yourself better.
आपका जॉइंट पहले की तरह हेल्दी होता है,
Yeah.
तो वो 2-3 महीने कहीं नहीं है एज कम्पेयर टू अगले 40, 50, 60, 70 साल जो आप जीने वाले हो.
This sounds so simple while I'm talking to you.
The arthroscopy is mostly needed.
It sounds scary.
Practice those good learnings into your patients so that they get better and better results all the time.
Oh, there's a surgery. Namaste, welcome back to another episode. Today we have with us Dr. Abhishek Mishra, whose intro needs to be learned and I was not able to, so I am just going to tell you that he is a specialist in orthopedics. He is a specialist in joint replacement and arthroscopy and has a long list of the education and the training that he has received. He is a MBBS, he is a MCH, he is a MS Ortho, he is a gold medalist and has received trainings from around the globe, be it US, be it Austria, be it Germany and a lot of places. So why not, let's learn a little more from the doctor himself. Hi sir, first of all.
Hi Sumati, pleasure seeing you.
Same here sir, thank you so much first of all for giving us your time.
Thank you very much.
Out of busy schedule, first of all, let's learn a little about your specialization. You have received training from around the globe.
Yeah.
And one thing, just one line, one thing before we start this episode, before we start talking about the topic today, one thing that changed in you or something that shifted in your life when you got all this training, when you were learning.
Oh, so actually that's a very interesting question. Learning, I'll tell you, it never stops. I'm still learning. I'm still a student.
Yeah.
And I started, say, around 23, 24 years ago, my orthopedics training. And it has been a long journey. And every day I'm learning, still I'm learning. The idea is to inculcate good learnings and practice those good learnings into your patients so that they get better and better results all the time.
Okay. I'll go back to
Yeah.
the question.
Yeah.
Because being a professional, we have a doctor sitting here. This is something that you answered is about the professional life.
Absolutely.
I'll go to the personal life a little and I'll ask that while you were receiving all this training, we always, enlightened with the new information, something that you remember every day in your personal life, one learning that you're carrying forward from all of this learning.
Oh, so I'll tell you, you see, I've been to so many places to grow my perspective, to broaden my horizon. And during this time, I was into different countries, I saw different people, I saw different types of human behavior, I saw different expectations in patients, I saw different behaviors in doctors. And again, you see, I'll tell you the same thing. It's all about learning and trying to put the best part of your learning into giving best results to your patients. So that's how I think learning should go on.
Okay. Now coming to the topic, we are going to talk about arthroscopic.
Arthroscopy, yeah, that's what, yes.
Today. As a person who has no idea about what this is.
Oh, so you are not supposed to, because this is actually a specialized topic.
Okay.
So arthroscopy, it actually comes from two words.
Okay.
Arthros means joint and scopy means to see.
Okay.
So arthroscopy is a very happening and very in surgery these days for so many reasons, because arthroscopy is mostly needed in young patients to maintain their lifestyles, to let them remain active, and most importantly to make sure that their joint doesn't go kaput very quickly.
Okay. When you say that this is, maybe we're seeing this in trend, this is something which is needed for particularly young age groups to keep themselves active.
No, it's not just that only young people need it, but mostly young people need it. Okay. And many a times it's very helpful in elderly people also. It is very helpful in treating their degenerative conditions, to alleviate the pain and again to make them more active and fit.
Today, before we go ahead in the conversation forward, I'll just say it's not a consultation for the viewers also. It's a conversation that we are having.
Right.
So, as a person who's sitting here who wouldn't understand doctor's terminology, when you say you mentioned something about degenerative. I'll just go back to that, and I love to understand about who might need arthroscopy. Who are these patients? What are the problems
Yep.
that they have?
Right. So let me put it like this. Probably it will be easier for all of us to understand. There is something called physiological age,
Okay.
and there is something called chronological age.
Okay.
So chronological age is like your date of birth. Like you were born in 1980 or 1990s, right? And then you calculate your age according to that year of birth. So somebody who was born in 2000 is now 24 years old. So this is like chronological age. Then there is something called physiological age. Physiological age is basically, it relates to chronological age, but it's not exactly chronological age. So I'll give you an example. Say suppose somebody was born in 1960, right? So almost 64 years of age now. That's
Yeah.
chronological. Now this 64 years old aged person is obese.
Yeah.
He has uncontrolled diabetes. He has hypertension. He has a very bad, poor lifestyle. So he's not only 64. You can add 10 more years to it. So he's actually 74. So this is like the physiological age. Similarly, like let's turn it around. Somebody who is born in 1960, 64 years of age, but he's a slim, fit guy with good habits, into fitness, does walk, does swim, doesn't have any comorbidities, no sugar, no blood pressure, no thyroid. Then he's actually, or he or she is actually not 64 years. He is maybe, you can say 45, 50, 55 years.
Okay.
So basically, this understanding this difference between physiological age and chronological age is very important. And doctors, we mostly look at physiological age, not the chronological age.
Yeah.
So suppose somebody who is 60, 65, 70 and he is very active, then he might need a similar surgery as is needed in a 30 or 40 or 50-year-old person.
Okay.
On the other hand, somebody who is obese and around say even 45, 50, we consider him for different kind of surgical procedure. Why this is important is, I'll tell you, you see this arthroscopic surgery about which we are talking today, it is primarily done for knee joint and shoulder joint.
Okay.
There are other joints also like the hip joint, ankle joint, elbow joint. The problems of these joints can also be addressed with this arthroscopic surgery.
Okay.
But mostly I would say like 75-80% of arthroscopies are done for knee joint and shoulder joint. And knee joint, it is done primarily for younger patients.
Okay.
For ligament injuries, for meniscus injuries, which is becoming very commonplace these days. Like it can happen after a sports injury, it can happen just by a twisting injury while dancing, while getting an accident, while just walking. You
Okay.
take a wrong step, you twist your knee in such a way that the ligament snaps. And then you start having pain and swelling. And pain and swelling, it actually goes in a couple of days. But this feeling of instability, this feeling of not having a proper balance, it remains. So that actually means that your ligament is torn. And if you don't get your ligament fixed, then you are not only like suboptimally active, but also you are making sure that you are punishing your knee. Your knee is going to need a knee replacement sooner, much sooner than in the normal course of time. So to address these kind of issues, we do arthroscopic surgeries. We fix the ligaments, we fix the meniscus. Meniscus is like a cushion between the two bony surfaces.
Okay.
It imparts this shock bearing capacity to the joint, and it also helps in making the joint well balanced. So this balance has to be maintained, and if this balance is maintained, the joint lasts longer. You are more fit, you are more active, you are able to indulge in all your physical activities, sports activities, fitness activities.
Okay.
So basically what I was trying to tell is, knee arthroscopies are primarily needed in younger patients, whereas shoulder arthroscopy, it is needed both in young individuals as well as elderly patients. In young individuals, it can be again a sports injury, and diabetics, many times they tend to have something called frozen shoulder or periarthritis, and they might need this arthroscopy for that if it is very severe.
Okay.
And in elderly people, there is degeneration, there is a structure on the shoulder, it's called rotator cuff. It degenerates, it tears without any reason or just by degeneration.
Okay.
And this arthroscopy can fix it in such a nice way that it becomes same as before.
Going ahead, whenever we hear this word surgery, when you were explaining this sounded very simple and something that will help a person to maintain an active lifestyle. But when we hear the word surgery itself, it sounds scary. Is it safe?
Of course, the word surgery itself is scary, and लोगों के हाथ पांव फूल जाते हैं और तोते उड़ जाते हैं if you suggest surgery to them, especially in our country.
Yeah.
I'll tell you, this acceptance of surgery, this is my experience, is much more in Western population.
Okay.
Like I've seen in Germany, I've seen in US, people come at a very early stage of problem, and doctors, they have a very high tendency. Their threshold of advising surgery is much less than ours.
Okay.
They advise surgery at a very early stage, and patients, they don't have any questions. They are very willing to undergo the surgery. But in our country, people think like maybe 100 times before they go for surgery, and they ask for advice not only from other doctors but also from their entire neighborhood, entire clan, entire relatives. And obviously, like if you ask 100 patients, 100 people, I think 90 of your relatives is going to say, nahi, surgery nahi karani. So this is a very common thought process in our population. And they don't understand that if they delay a surgery too much, then the condition, it becomes much worse, and the technicalities of surgery, they become much more complicated. And obtaining the same results as you would have attained like in the early stage, it becomes difficult. So this mindset has to be changed. And obviously, undergoing the knife, if somebody tells me that I have to undergo surgery, probably I'll also think, but I will not think too much, because this is what I do day in and day out. But obviously, for a layman, I understand that they have to think, but they should understand that this is for their own betterment. And if a doctor is advising, the doctor is advising with some conviction. Doctor also feels that the patient would get results, and only then the doctor is advising surgery. It's not randomly. And about this arthroscopic surgery, let me tell you, obviously it is not joint replacement. Even joint replacements, I would say it's one of the smoothest and easiest and relatively smooth surgeries. Arthroscopy is much more easier. The magnitude of surgery is much less. The cuts are much smaller. The recovery is much faster. आप सर्जरी करते हो, दूसरे दिन से पेशेंट चलने लगता है, just like in joint replacements. And certain period of physiotherapy, and the recovery is very good. And the best thing about arthroscopy is what people, you see, they always judge the surgery by the number of stitches they get. So surgery से पहले कई लोग हमसे पूछते हैं कि टांके कितने लेंगे. Actually it hardly matters टांके कितने लेंगे. More important is what you do inside rather than टांके कितने लेंगे. So but in any case, in arthroscopy, टांके minimal 2-3 टांके लगते हैं, उससे ऊपर नहीं लगते हैं, क्योंकि आप सारा काम you are doing with arthroscope, which is like a device similar to laparoscopy in general surgery. So basically, you make small cuts and you use your instruments to go inside the joint, actually visualize the joint, to actually see it is in front of your eyes. So sometimes I would tell you, you see, we regularly kind of advise MRIs to patient, and sometimes even the reports of MRI or the findings of MRI are not very precise. So what you see from your own eye is the final word. And in arthroscopy, you are actually visualizing the joint, inside the joint, without giving any big incision, and you are doing whatever you need to fix that joint immediately at the same time. So you can fix ligaments, you can fix muscles, you can fix tendons, menisci, and so many things, and you can make sure that your joint lasts longer and longer.
This sounds so simple. While I'm talking to you, I am sure it's a very difficult task being an expert. Only thing I am, being enlightened here is that when we say the word surgery is something के OT से वापस आएंगे नहीं आएंगे. That's all we think of our mindset.
No, that is very far-fetched thing.
Oh, there's a surgery.
I'll tell you, no, this is the extreme of it. I would say this kind of mindset should be there only in cardiac surgeries and neurosurgeries. Even I would say that at this time and age, even cardiac surgeries and neurosurgeries are very safe and very streamlined. I mean, this is not the case at all in arthroscopic surgeries. Very simple, very smooth, very straightforward. For a surgeon, the learning curve is quite steep, but once you reach that level, it becomes like for some arthroscopic surgeries, we finish in 10 minutes actually. It doesn't take much more than 10 minutes. But then again, let me tell you, for patients, it might be longer, because patients, they start calculating the surgical time from the time they are moved out their room. मरीज वहां से शुरू करता है, जैसे हम बताते हैं कि आधे घंटे की सर्जरी है, मरीज का दिमाग क्या चल रहा होता है, पेशेंट थिंक्स लाइक दिस कि 11 बजे रूम से बाहर निकले, 11:10 पे 11:15 में ओटी में पहुंचे, फिर वो इंडक्शन रूम में रखते हैं कुछ देर 20-25 मिनट, फिर एनेस्थीसिया लगता है आधा घंटा, फिर उसका सफाई होती है, बिकॉज बिफोर any surgical procedure, in fact especially so about orthopedic procedures, this cleaning and draping continues for very long.
Okay.
So actual surgery starts approximately 1.5 hour after the patient is shifted from the room.
Okay.
So and then after surgery around 15-20 minutes for recovery and then shifting back. So मरीज का दिमाग उस हिसाब से चल रहा होता है, हम कहते हैं 20-25 मिनट की सर्जरी है, पेशेंट कहता है डॉक्टर साहब मैं तो 2-3 घंटे रूम से बाहर रही. सो एक्चुअली ऐसा होता नहीं, एक्चुअल सर्जरी 15-20 मिनट, आधे घंटे. इवन द लॉन्गेस्ट ऑफ आर्थ्रोस्कोपिक सर्जरी दे डू नॉट स्ट्रेच बियॉन्ड 1 hour, 1.5 hour. The shoulder repairs and all, it doesn't take more than 1.5 hours. So this is how it goes. So it's, you can say it's very short and sweet surgery.
As mentioned, I think the longest of the surgeries would go for 1.5 hour, very
Yes,
short and
absolutely.
sweet.
Yes.
But again, going back to the word, it's a surgery.
Of course, it's a surgery.
And it's a difficult task.
A surgery is a surgery is a surgery, yes.
And you have received years of training and you need
Right.
years of expertise to conduct that. I'm sure sometimes there would be complications, there would be patients in front of you would have risk. Would like to understand what are these complications, what are these risks, and who can have it. It's not like you will have complications for every patient who's out there on the table.
So
But
that's a very pertinent and important question. So you see, complications. Complications are a part and parcel of surgical field. Just like complications are a part of life. If you are alive, you are bound to get complications. Every surgery has certain amount of complication, and the risk of complications is explained to the patient prior to surgery. Talking about complications, I would say that it depends on so many things. I would not say that arthroscopy में complication नहीं होते या zero complication rate. It's not like this. If I say this, probably I'm lying. Arthroscopy में भी complications होते हैं, but the complication rate is very very low. In fact, I would say much less than any other surgery.
okay.
Complication, you see now again, you go to the hospital.
Yes.
I'm not talking about surgery right now.
No.
You undergo any procedure. You go for a simple antibiotic injection, suppose, or any other injection, and suppose there is a side effect to that reaction, hypersensitivity or allergic reaction, that can turn it into a big mountain
Oh, okay.
out of a molehill. So छोटी चीज भी कई बार बहुत कॉम्प्लिकेटेड हो जाती है, ऐसा होता है प्रोबेबिलिटी, बट इट हैपेंस 1 in a million टाइम्स. सो आर्थ्रोस्कोपी में कॉम्प्लिकेशन के रेट्स बहुत कम है. आई वुड से 2 to 5%, not more than that. Or then again it comes about, let's talk about the doctor's perspective, then let's talk from the patient's perspective. So complication, doctor's perspective, you see doctors teaching, learning, the idea of the whole process is to ensure that the complications are less, results are the best, and patients' expectations are fulfilled. So when we begin our training, it starts with information. We gather information, we process it, and we apply this information during our surgical practice when we start. Then gradually with time, with years, with experience, we become knowledgeable, like we have our own knowledge, and we try to put that knowledge in during surgery to minimize the complications and to make the results better. And in the last stage, there comes wisdom. So wisdom is basically I would say, the final part of the surgical learning curve or surgical learning process, when you know within your mind what you have to do and what you are not supposed to do for a particular patient. Sometimes you have to intervene till a certain limit only, because sometimes over intervention can actually jeopardize your results. So this is from the doctor's perspective, and I know and I feel that every doctor, to the best of his or her knowledge, tries to do the best for the patient. And how knowledgeable and how informed he is, more than this, the more important is how wise the doctor is, and wisdom comes with experience and learning. So just like when you are going to buy property, they say location, location, location. That's the keyword. So I would say when you are going to a surgeon, it's wisdom, 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 which comes with experience. How many surgeries you have done and what kind of results you are given. This is very important to reduce the chance of complications. So this is from doctor's perspective. Talking about patient's perspective, I would say this arthroscopic surgery is a very important part is rehabilitation.
Okay.
I would say this rehabilitation part in arthroscopic surgeries is much, much more important than any other surgery. A patient who is not very motivated and who skips his rehabilitation regimen probably would not have such good results as a person who is very diligent and devoted towards rehabilitation.
Okay.
Then it also depends on how bad or how old your condition was before you underwent the knife, before you underwent the surgery. If the disease was very advanced, then the chance of complication obviously becomes less.
Okay.
Or if you plan to undergo your surgery many years or much like after a very long time, then obviously the chances of complications are more. So apart from these patient factors, then obviously there are certain inadvertent factors like I would say idiosyncratic factors about which nobody can predict, neither the doctor nor the patient, but complications can happen. But then again, you see, this reminds me of a शेर. It says सही सवारी गिरते हैं मैदान जंग में. अगर सर्जरी करेंगे तभी कॉम्प्लिकेशन होगा.
Yes.
और अगर बैठे बैठे सोचते ही रहेंगे तो ऑब्वियसली कॉम्प्लिकेशन के डर से तो ना आप बीमारी ठीक कर रहे हो ना सर्जरी कर रहे हो. So that's how it is.
Once you go through this surgery,
Right.
okay, this is to, of course, make yourself better,
Absolutely.
be more active.
Yes, more fit, more
Yes.
healthy, to make sure that your joint lasts longer. And you see the joints, the health of joints is very, sorry I cut you, but you can, I'll just,
Yeah.
health of joints is so important because the joints are the things which keep you mobile.
Yes.
And mobility is health, mobility is life, mobility is freedom. If you're not mobile, if your joints are not healthy, then your movements are restricted, and restricted movements means poor quality of life. It means inviting more and more diseases like hypertension, thyroid,
Yeah.
diabetes, everything becomes more if your mobility is less. So it's not only about alleviating pain, it's also about making the quality of life better.
Yeah.
So improving the quality of life.
We understood that it's a simple surgery. It is to make the person healthier and more active. But do you think that after getting this surgery, you mentioned somewhere in the starting of the conversation also that एक दो दिन में, you know, the person is back on.
Oh yeah. So you see, you caught me there.
Yes.
When you say ek do din, it doesn't mean that you become 100% normal in ek do din.
Okay.
You start going to your office in ek do din. It doesn't happen like this.
Okay.
It always needs some time. So when we say ek do din or 1-2 days, it basically means you're back on your foot
Okay.
after 1-2 days. But to become 100% normal, it takes some time, say 3 weeks, 4 weeks, 6 weeks, depending on the magnitude of surgery. For example, I'll tell you, if you have done a surgery for anterior cruciate ligament reconstruction, ACL reconstruction, then to reach the stage when the patient starts going back to his office comfortably and all, it takes around 3 to 4 weeks.
Okay.
And going back to sports takes somewhere around 3 to 6 months.
Okay. 6 months.
3 to 6 months going back to sports.
Okay.
Obviously, you see, I'll tell you the difference. In arthroscopic surgeries, you are not replacing something. It's not joint replacement.
Yeah.
In joint replacement, you have taken out the diseased part and put an artificial part.
Okay.
So obviously, you are not worried so much about healing part of the body,
Yes.
right? Healing part of the body,
Artificial
yes, because you put
Yeah.
an artificial part.
Yes.
So you can start let the patient. You can allow the patient to do virtually whatever the patient can do from the next day.
Okay.
When you are doing arthroscopic surgeries, basically you are preserving body's own parts.
Okay.
You are reconstructing them or repairing them, and you are depending on the body's capacity, and there is a timeline for healing. Everything doesn't heal in a day.
Yeah.
So you have to take it easy. You have to go slow, bit by bit, step by step. It reaches you there, it takes you there to the original stage, but it takes time. Till the time it is a little healthy, you have to protect it. That's why you can't go back to all the activities immediately.
Yeah.
So I'll give you a broad time frame. So जो common surgeries होती हैं, नी के लिए ACL reconstruction होता है और meniscal repair होता है. ACL reconstruction recovery is faster. Meniscal repair recovery is a bit slower because you have to kind of protect the repaired meniscus, and you have to increase the bending of the knee gradually. So meniscal repair को थोड़ा ज़्यादा लंबा rehabilitation चाहिए, ACL को थोड़ा कम चाहिए rehabilitation. शोल्डर की बात करें तो 2-3 प्रोसेस बहुत कॉमनली किए जाते हैं. एक तो एक्रोमायोक्लेविकुलर जॉइंट का डिजेनरेशन, अगेन दैट्स अ टेक्निकल वर्ड. कई बार हड्डियां बढ़ जाती है, पेशेंट को पेन होता है. ये ज़्यादातर वेट लिफ्टर्स या जिम जो जाते हैं उनमें ज़्यादा होता है. अदरवाइज जो ओवरहेड एक्टिविटी करते हैं उनमें भी हो सकता है. तो ये बहुत छोटा सा प्रोसेस होता है, एसी जॉइंट डिब्राइडमेंट कहते हैं. आर्थ्रोस्कोपिक एसी जॉइंट डिब्राइडमेंट, इसमें रिकवरी बहुत फास्ट होती है. दूसरे दिन से आप सब कुछ शुरू करा सकते हो.
So the weight lifting also.
Obviously weight lift.
Yeah.
So weight lifting is after a couple of weeks, say 4-5 weeks.
सब कुछ it means, yeah, but you still
सब कुछ
need
so
to give
time
to
yes
heal.
for to heal.
Okay.
तो इसी तरह अगर आपने कोई मसल रिपेयर किया है, say I would say रोटेटर कफ रिपेयर या सुप्रास्मैटिस रिपेयर किया है, तब तो आपको तकरीबन 10-15 दिन तो शोल्डर को इमोबलाइज करके रखना होता है।
Okay.
उसके बाद आप फिजियो शुरू कराते हो, तो अगेन 1.5-2 महीने 2.5 महीने लग जाते हैं।
Okay.
अगर आपने बैंकार्ड्स रिपेयर, सपोज किसी को रिकरेंट डिसलोकेशन है, किसी का कंधा बार बार उतर रहा है और उसको आपने फिक्स किया है आर्थ्रोस्कोपी से, आर्थ्रोस्कोपी बैंकार्ड्स रिपेयर कहते हैं उसे, देन अगेन ऑलमोस्ट द रिकवरी इज सेम 1.5-2 महीना, एंड टू गेट बैक इनटू स्पोर्ट्स 3-4-5, and to be on the safer side 5-6 months. So that is what is recommended. So I would not say कि आज कराया और आप कल जेट प्लेन की स्पीड से जा रहे हो. It takes time, but the idea is by giving that much time आप अपने शरीर को या अपने जॉइंट को पूरे लाइफ के लिए हेल्दी रख रहे हो. अगर आपको 2-3 महीने देके अगर आपको पेन से छुटकारा मिल जाता है, आपका जॉइंट पहले की तरह हेल्दी होता है, तो वो 2-3 महीने कहीं नहीं है एज कम्पेयर टू अगले 40-50-60-70 साल जो आप जीने वाले हो. So that is the idea.
And we have the results, so you don't need to get it anytime again.
Yes. So again, you see, revision surgeries are not something which are unheard of. Revision surgeries भी होती हैं, but they are very rare, and they again, I would say, this is a complication which might result in revision surgery. ये तभी जरूरत पड़ती है अगर किसी वजह से पहली सर्जरी कामयाब नहीं रही है. उसमें अगेन बहुत सारे फैक्टर्स होते हैं, पेशेंट फैक्टर्स या सर्जिकल फैक्टर्स. Let's not go into that. So because this is a very rare scenario. Talking about primary arthroscopies, they are again very successful and very commonly done procedures.
I think the cases that you would be handling is something very different every day, and every case would be very different depending on patient, their health.
Oh yes. So you see, surgeries we do, they are more or less stereotype.
Okay.
But the patient, every patient is different.
Every patient is
their expectations, their build, their mental frame of mind, their willingness for surgery, their acceptance towards surgery, their acceptance towards recovery time, that is very different. So for us, again, their anatomy. You see, we say that in medicine, medicine is not like mathematics. Medicine is an art, it's not a science, especially surgery. मेडिसिन में 2+2 4 नहीं होता है हमेशा. 2+2 कभी कभी 3.5 भी होता है, कभी कभी 5 भी होता है. तो हमें हर एक पेशेंट को उसके नजरिए से थोड़ा अलग से देखना पड़ता है. कोई बहुत दुबला पतला है, उसकी सर्जरी 10 मिनट में खत्म हो जाती है. ऑन द अदर हैंड, somebody is obese, then it might take a little longer. Recovery also might take a little longer. So there are patient factors, individual factors we have to take into consideration while doing surgery, and everything ये हमारे दिमाग में चल रहा होता है, in the back of our mind. So this is what I was telling you about wisdom. With experience you gain wisdom, and all these things, they keep playing at the back of your mind, even when you are not explaining to the patient, but you know that this is what you are expecting to see during surgery, and this is what you are going to expecting to see during rehabilitation, and that's how you explain to your patient.
Something, I don't know if I should ask this, or I hope that you don't mind this question, but if somebody wants to get in touch, something we need to know is that, as you are saying, this wisdom comes with experience. It's been more than 2 decades that you have been doing this. You started our training. How many surgeries have you done until now?
So I'll tell you, I was counting. No, I'll tell you. You can ask. This is a very pertinent question. I was counting till first 1,000, say 1,200 surgeries, which was almost 15 years ago. After that, I stopped counting. So now maybe I would say, like, there's just a guesstimation, maybe more than 10,000 surgeries.
Wow.
More than 10,000. More for sure, not less. So at that I'm considering all kind of surgeries.
10,000 surgeries.
All kinds of surgeries, from small, major, minor, everything included.
When you say that, you mentioned that it might take 2 to 3 months of your life, but you will be healed for another 30-40 years.
For life,
years.
maybe, yes.
For life.
Yes.
Now, it's as simple as you're repairing a part, it's not new. Something I want to understand, a new is something, God created us, gave us a new system. Now, when we are repairing something, are there any limitations, any precautions? Particularly, we'll start with limitations and then precautions a person needs to.
So yes, again, that's a very smart one. We are surgeons, we cannot be gods. So to be very honest, we can't give God has given, but we try to give as close to what God has given. So obviously there are limitations, but usually in day-to-day practice, these limitations are so minor and so less that they don't count. So you can say that if not 90% similar to the original part,
Okay.
if not 100%.
I think also
which is as good.
limitations would differ again.
Yes,
according
again,
to
it would depend on
patients,
lifestyle,
according to
depend on the
age.
habitus,
Yeah.
the build of the patient, age of the patient, hobbies of the patient. So all these things. So it's a multifactorial thing. It's not one factor. Again, I told you that in medicine is not 2 plus 2 is 4 always. It can be 3.5 or 4.5 also.
Something that's coming to my mind again and again. I think this is the very first conversation I am having with a doctor where I cannot ask about the medications. I just want to understand arthroscopy is a surgery that we are talking about.
Yes, of
it's
course,
a
it's
surgical
surgery, yeah.
procedure. Is there any alternative to this surgery, or if a person has to get it, he or she has to get it?
Oh, so you see, so we are talking about two things here. There is something called evidence-based medicine. So there are certain conditions for which there are many options.
Okay.
You can deal with those conditions or situations or diseases without surgery also.
Okay.
But the results would not be as good as when you are opting for surgery, especially the long-term results. For example, let me give you an example, and it will be easier for you and people to understand. Suppose somebody has a bad meniscal tear, young person, or suppose let's take the very common condition of ACL tear, anterior cruciate ligament tear. It is known, it has been researched, it has been seen, it has been observed. Everybody knows this. आज मेरा ACL tear हुआ suppose, मेरे घुटने में सूजन रहेगी, दर्द रहेगा, वो 5 दिन, 7 दिन, 10 दिन, 15 दिन, महीना दिन, 1-1.5 महीना रहेगा, और धीरे धीरे दर्द भी चले जाएगा और सूजन भी चला जाएगा, और वर्चुअली मैं सब कुछ कर पाऊंगा. मैं सर्जरी भी कर पाऊंगा, मैं दौड़ भी पाऊंगा, मैं क्रिकेट भी खेल पाऊंगा, मैं ड्राइव भी कर पाऊंगा, पर मेरा नी नॉर्मल नहीं है. तो कहीं ना कहीं मेरे दिमाग में ये आभास होता रहेगा. सपोज आई एम गोइंग डाउन द स्टेयर्स, आई हैव अ फीलिंग दैट माय नी माइट गिव वे. इनस्टेबिलिटी की फीलिंग रहेगी. मैं बैडमिंटन या क्रिकेट खेल रहा हूं तो मैं उतना ऑप्टिमल नहीं दे पाऊंगा. सो दिस इज वन फैक्ट, मैं 100% नॉर्मल नहीं हूं. मैंने ऑपरेशन नहीं कराया है, मुझे ऑपरेशन प्रोबब्ली सजेस्ट किया गया था, आई डोंट वांट टू अंडरगो नाइफ. मैंने सर्जरी नहीं कराई, मैं 100% नॉर्मल नहीं हूं. एक तो ये बात हो गई जो मुझे फील हो रहा है. जो दूसरी बात है, साइंटिफिकली ये प्रूवन है, इट हैज बीन सीन इन रिसर्चेस एंड पेपर्स एंड एवरीथिंग, इट हैज बीन पब्लिश्ड कि अगर आपका एसीएल टेयर है तो आपके मेनिस्कल टेयर होने के चांसेस कई गुना बढ़ जाते हैं. सिर्फ एसीएल टेयर होने से, क्योंकि नी का मूवमेंट एबनॉर्मल हो जाता है. मेनिस्कल टेयर होने के बाद नी का वेयर एंड टेयर बहुत फास्ट रैपिड हो जाता है. तो सपोज नॉर्मल कोर्स में मुझे अपने लाइफ टाइम में कभी नी रिप्लेसमेंट कराने की जरूरत नहीं पड़ेगी. लेकिन अगर मेरा एसीएल टॉर्न है और मैं उस नी को फिर भी इस्तेमाल कर रहा हूं, so there is very high probability that within the next 10, 15, 20 years I might need to undergo knee replacement. So यहाँ दो बातें हैं, न सिर्फ मैं अपने प्रेजेंट लाइफस्टाइल में कॉम्प्रोमाइज कर रहा हूँ, वो नी में इनस्टेबिलिटी की फीलिंग और अपने एक्टिविटीज को कर्टेल करके, बल्कि ऑल्सो आई एम इंश्योरिंग दैट आई बिकम अ कैंडिडेट फॉर जॉइंट रिप्लेसमेंट सर्जरी. सो यहाँ देखिए दोनों ऑप्शन है. आप ऑपरेट नहीं भी कराते हो तो भी चलता है, पर वो चलता है वाली बात है, वो 100% सही नहीं है. दूसरा, आप ऑपरेट करा के थोड़े दिन, 2 महीने 3 महीने का रिहेबिलिटेशन पीरियड झेल के आप अपने नी को ऑलमोस्ट नॉर्मल या नॉर्मल बना रहे हो. तो ना सिर्फ आपने सिम्टम्स, तो बेसिकली ऑप्शंस की बात है, क्या ऑप्शन आप लेना चाहते हो. और अगेन आर्थ्रोस्कोपी बहुत सिंपल सर्जरी है. इतनी सिंपल सर्जरी के बाद इसको आप नॉर्मल कर सकते हो. आई पर्सनली वुड फील, अगर मैं पेशेंट हूँगा, अगर मैं लेमैन भी होऊंगा, तो मैं हमेशा सर्जरी के लिए जाऊंगा, नॉट द नॉन सर्जिकल ऑप्शन. सो सिमिलरली ऐसे हर एक सर्जरी के साथ कुछ पहलू हैं. सो दिस कैन बी एन एग्जाम्पल.
This is a very important question for me and for the viewers, and I started the conversation today with this. Now we had a lot of information in last some minutes that we have talked about arthroscopy. I'll go back to the very first question that I asked you, was that while you were getting the training, while you were learning, again I want you to just go back and think one thing that you learned from all this training, as simple as when you learn that, oh, joints are this important, what are the things that I can do in personal life so I don't need to reach a, I'm sure there would be cases where a person would need a surgery, but I am just talking about the kids who are living a normal life, and particularly in the sedentary lifestyle right now we are living, we're not taking care of joints a lot, we are not moving a lot. Anything that you would give a tip, an advice to the young generation out there, and all the listeners who are listening, seeing you're maintaining a healthy lifestyle, working out and being active. Any tips that you would like to give so we don't reach a stage where we would need?
So actually, you answered your question in yourself.
Okay.
While you were asking the question, you said like in first line
Yeah.
that in today's world, the normal lifestyle and all that,
Yes.
right? And what should be the advice?
Yes.
And another, like after 2-3 sentences, you said that in normal sedentary lifestyle.
Yes.
So I'll tell you today, actually the lifestyle is not healthy. Sedentary lifestyle is very bad. Human bodies, they were not meant to sit for long hours.
Okay.
If you go back in time and if you think about it, our ancestors, our forefathers, their ancestors, कोई 2-3 घंटे 6 घंटे चेयर पे नहीं बैठता था.
Okay.
आज all white collared workers, all people who work in offices and people who work on system, screen, I mean they keep sitting for hours and hours together without caring about their posture, the ergonomics, their joints. So you see, my only advice is to give some time, at least half an hour to 40 minutes every day to your body, to your joints, to your health. Make sure that you're physically active, go for walk, go for swim, do a little bit for yourself, which will ensure that your body remains healthier. Your chances of coming to me reduces, your chances of going to a doctor reduces. So that is my only advice. Give 30 to 45 minutes to yourself.
With that, ladies and gentlemen, we are having conversation with Dr. Abhishek Mishra. And sir, thank you so much.
Sumati, thanks, Tan. It was a pleasure having you here.
Same here. It was an honor to be sitting here and
thank you very
learning
much.
all
Thank
about
you.
this. So thank you once again to all the viewers who have been here. I hope that we got a lot of information. We will keep getting a lot of these podcasts, a lot of these discussions with the experts. I would love to mention this, that nowadays we have a lot of information out there, no doubt. I think all of us would agree, sir, that lots of information, but is it the right information? Is it the expert giving an information? As I mentioned, we are taking this expert advice about arthroscopy from a person who has done more than 10,000 surgeries around the globe. Right information? Yes, we'll keep getting these. If you want to get in touch with Dr. Abhishek Mishra, you can get on to the helpline of Apollo Spectra Hospital. We'll see you in another episode. Take care. Have a great day. Namaste.